What's going on, Radio World? This is the Sons of Liberty, and I'm AJ Melillo. I'm joined, as always, with my wonderful co-host
Stephen Rumbolo, what's up?
and our news director at WMSC, Loop D. Lewis. What's
How
going on?
y'all doing? You're promoting me a little early. Steven's still here.
Well, I'm saying I'm pretty sure this week is the week that we're really putting that ball in motion of
Oh.
changing the guard.
All right, bye, Steven.
I know, I'm out.
But you're listening to 90.3 WMSC, Upper Montclair, of course. This is the Sons of Liberty. And Annabella's putting in our chat as we are going through Zoom, as we have been for the past few weeks, to congratulate me as I will be moving up to the new station manager. So thank you, Annabella, and thank you, everybody, for the opportunity. But we're going to get into a lot of news. A lot has been going on, more than just COVID-19 stuff. So we are going to talk about that. But before all of that, as per usual, let's hear what's going on the ground with you guys. We'll start with Lewis. How are you? What's going on with the family? Everybody's okay? What's going on?
Family's good. We're just chilling after that storm the other day, knocked some trees down, but we're all good, doing some work. Everybody's in different rooms, doing different activities that they have to do online. But it's spring break for schools. My sister's a teacher, so she's off, but still doing work for next week. It's a little strange. My mother's a para, and so she doesn't have to work this week because it's spring break. So we're all just chilling.
Good to hear. How about you, Steve?
Well, this week's going to be tough. I got a big paper proposal due, as do you. I also picked up a new job just to go make some money during all this stuff, so I'm going to start that soon. I have internship training tomorrow on Zoom for the Mikey Sherrill team, which I'm looking forward to a lot.
Friend of the station and show.
Exactly. And the university. She does so much at Montclair State. Other than that, just kind of hanging out, working out, the usual, nothing crazy. I got to say, the one good thing, and I'm sure Annabella knows this, is SiriusXM just gave free access to like the middle of May. So I've been listening to so much Howard Stern. It is incredible.
Did you catch that Stern Tom Brady interview?
It's on the list. It is on the list. But he really is like pulling in some fantastic people. And they have a bunch of archives of like old clips of old interviews and stuff that he did. So I listened to one from like the 90s that he did with Eddie Murphy, and it was hysterical.
That's awesome. So SiriusXM has that free membership. So if you're interested in catching up some old interviews, that's a possibility of a thing you could do. Or you could catch up on some of our old interviews too if you're interested on Apple Podcasts and SoundCloud. We got some really good ones, including our most recent one was Mikey Sherrill's opponent in this upcoming campaign and election, Miss Rosemary Becky. So I don't know if you want to check that out. That's pretty cool. But Howard Stern, Annabella said, had Cuomo on recently, so that's a big interview too if you want to check that out. But let's get into some of the news. Why don't we?
How about you?
Oh, how about me?
We're not just going to skip over the new station manager.
That's fair.
Of course not. How could we?
Life is going on. Actually, I got a bit of good news today. Really good news. I was awarded a scholarship from our political science department. So that's really awesome.
That's what we like to hear.
A pretty big chunk of cash, so I'm not going to be complaining at all about that. But
congratulations.
I got a lot of work. A lot of essays, stuff like that going on. But we're going to get through it because that's what we do, right?
What we do. We loop-de-loo on through.
So let's get into the news. So let's start off with some corona numbers. Why don't we, right? So
the only numbers people have been seeing as of late.
It's true. So is my screen shared? Everybody sees it, right? Yes. So obviously we're going to the one that we've always gone to is the John Hopkins graph here. So if you look globally, you got 2,008,850 total confirmed cases in the world right now. You have 129,045 deaths and 3,000,000 138,413 total tests for COVID-19. Along with that, you have 502,389 recoveries globally. But there is a new feature here with the COVID-19, and that is just looking at the United States and the map of our country right now, so we could see the numbers in the United States and where it is the most affected, which is in the area that we're in. New York and New Jersey are the two most affected states in the union right now. So in our country right now, there have been 601,472 confirmed cases, with the most of them in the Queens of not the Queens in New York City, with unfortunately 24,429 total deaths, again, most of which in Queens, but 43,482 total recoveries, which is obviously a good thing that people are recovering from this.
Just to stop you there for a second,
Sure.
I want to make sure we clarify. Not most of those deaths were from Queens. It's just the most out of any county.
Sure.
Queens has a little over 2,000 deaths.
Right, a polarity.
Not close. Yeah, that's the word.
My bad. A polarity, not a majority. Good catch, Lewis. Good catch. So, a lot of those deaths are in New York City as a whole, not just Queens. So when you look at it, obviously it's broken down by color. The deeper the red, the more densely the case numbers. So if you look, New York and New Jersey is pretty much covered in red, with bleeding into Pennsylvania and going up into the New England region.
Even Delaware.
And Delaware has, the entire state of Delaware is in red because there's only 3 counties.
Yep.
But to be fair, when you look at the numbers, right, they don't look as big because it's a smaller state, obviously. So when you look at, say, Kent, Delaware, there's only 329 cases. There's just not a lot of people that live in Delaware.
It's peculiar how the cut on Maryland is just so crisp from like red to, I think it's like borderline
to like white,
yellow.
Yeah. And there's some in this area here is interesting by the Chesapeake Bay because parts of it is Maryland, parts of it is Delaware, and parts of it is Virginia.
Mm-hmm.
But Delaware is the deepest red, and the Virginia and Maryland parts are not. So you're right. That is interesting.
I don't know what the governors of those states have been doing, but clearly if the governor of Delaware put in some kind of stay-at-home order or some harsh social distancing measures like we have here, it seems like the people in Delaware are listening because that cut is too clean for any other explanation.
Right. Well, I think that they have some sort of a travel restriction that they are recommending not traveling outside of the state. So I think that is a big reason why. Because you can even look at the county in New Jersey that's closest to Delaware, Salem County. Again, it's not that deep red.
Yeah.
So
makes sense.
That's some of what's going on in actually, so if you look, this does have it confirmed by the population, so you get more of a per capita look at what's going on. So still, if you look at New York and New Jersey, that's where the bulk of
that map looks a lot nicer though, because if you look at the southern half of New Jersey,
it's not as deep.
Yeah, we're seeing some lighter colors there.
Yeah.
And it makes more sense for the Denver. I was looking at Delaware issue we were talking about.
Right, exactly. So those are some numbers and some looks at you. Obviously, this is still a problem. It's still going on. There are still hundreds of thousands of people that have the illness, and more are coming in every day. Andrew Cuomo did say that it looks like we are hitting some sort of a plateau in New York, which is good, and it's looking like it's going to start going down, if not already. It is going down, so that's a good sign. And New Jersey's peak I saw recently was moved. They think we're going to hit it next week now instead of this week, based on different projections. But the models are made by human beings, and human beings are not perfect, and that is why you are seeing a lot of changing in the models as time progresses here.
Just for fun, can we click the critical trends? Because I I don't think we've ever looked at that on here, and I'm just
Sure.
curious to see what
So
it shows.
um, this will show which one would you like to really look at? How mortality rate differs, how the outbreak's going. Has the curve flattened?
I
Let's
think
do
that's
that.
what we should check out. Yeah.
All right, let's see. Has the curve flattened? So if we look, um, this green number is the U.S. and we had a peak of 33,000 new confirmed new cases on around April 12th, and since then that has been on the decline. So it does look that we hit our peak as a country, but each state is hitting its peak at a different time, obviously. So that's a good sign. Obviously, we are on the downward trend here.
What are some of the other countries that they have up there just for
Reference
reference?
points.
Yeah.
So here you have France, who hit its peak. It looks like a little bit earlier than us in April. You had Spain, who hit its peak towards the end of March. Germany, Italy, France. This is France again. United Kingdom, who seems to have hit its peak around this. Who hit its peak the same time as us. You have Iran, who had a very steady slope, and then you have Belgium and the Netherlands here. And then China down here, who hit its peak supposedly long before everybody else. Obviously, it had the cases there first. So this is saying that it hit its peak out in February. But to put it out there, most experts are saying that China's numbers are probably not the most accurate.
And we are seeing that China is reporting some new numbers now.
Right, their death.
So
hitting
China
death
and
cases.
Russia is going up now.
Right. So those are some of the numbers for you there. And yeah, Russia is, as you said, Lewis, Russia's numbers are going up too. So it looks like for the United States, we're on the downward slope of this, and hopefully it maintains that way, and we'll start to see real progress around May. But it's really up to the virus at this point and us to keep listening to the social distancing measures and all of the things like that from our governors. So
April distance brings May existence. That's what
there
I've
you
been
go.
seeing everybody saying online.
So that there are some of the coronavirus numbers for you. 1 second here. What do you guys do? You guys have anything to add? Anything to say about that? To maybe things that you've heard about the virus so far that you want to bring up just before we end talking about the virus in particular?
I mean, as far as day-to-day life, it's becoming a little more like I didn't think it ever feel normal to see people in, shopping marts and driving around wearing masks, gloves. Um, I don't know about where you guys are, but the grocery store on the island, I haven't seen toilet paper, paper towels, or tissues in it still to this day.
I'm seeing
And
some
they,
at Target. If you have any, if you want to come over the bridge, I
yeah,
saw enough at Target and the ShopRite over on Fisher.
but that and just there's some weird, I want to say like privately employed social distancing measures. Like at the Acme over here, they made aisles go one way.
Same at
So
ShopRite, yeah.
see, I didn't know that, and I didn't really understand the logic until the guy explained to me, like, if you're all traveling the same direction, you're preventing this, walking into each other, you're just kind of following, it's easier to maintain the distance. So I really like that there's some companies in some places that have stepped up to the plate really and gone beyond what's recommended and put in these extra safety measures. I know they're also counting the number of people in stores to make sure that they're not overcrowding the stores and people have certain hours they go in. They've been doing senior hours, so I think that the response is getting better with time, and that's
And I
very
don't know if you've heard,
good.
going along with that, Whole Foods is doing something where you have to have been a shopper before now to be able to shop there. You had to have a card, and if you don't have a card, you have to apply for a card and tell them what time you're going to be going.
Similar
things
to
like
how
that.
BJ's runs business on the usual. See BJ's and Costco and places like that.
Exactly.
But if you want more information on the supply chain and things of that nature and what's going on with the stores and the economy, tomorrow on our program News Dive here at WMSC, a supply chain guru, Dr. Hal Ravindir, a professor for the Feliciano School of Business, is talking with Sam Harrell and Joe Amditis. So if you're interested with that, he claims that our nation's obsession with toilet paper is because it represents civilization, which honestly, if you think about it, makes a lot of sense to me, because indoor plumbing is a big factor in the advancement of civilization, and essentially toilet paper is a big point of uh,
It's
indoor
funny that
plumbing.
you took the indoor plumbing route, because I was thinking, because our society is such a mess, we need something to clean it up with.
Oh, fair enough.
Listen, either way, I'm intrigued. I think I'm going to go and listen in. So that's tomorrow during News Dive, and I believe that is from what time to what time? I
4 to
believe
5.
that's 4 to 5, right?
So moving on now a little bit, we're still Corona related, but not specifically about Corona. It works perfectly since we were talking about the economy. Andrew Cuomo, along with Governor Murphy and the governors from a bunch of other states in the region, Pennsylvania, Delaware, Connecticut, and Rhode Island, are talking about creating a new task force, or they're going to create a new task force rather, and talk about their decision on how to reopen the region's economy. So this is a NBC New York article. United by an unprecedented pandemic that has forced the region into a standstill, a number of governors from the Northeast, including those of New York, New Jersey, and Connecticut, are coordinating efforts to reopen the region safely and strategically, although no one knows when the reopening will take place. Andrew Cuomo welcomed governors of New Jersey, Connecticut, Pennsylvania, Rhode Island, and Delaware during a press conference to announce a joint task force designed to develop a plan to reopen a regional economy. He said, quote, "We have never been in this position. That does not mean that you cannot guarantee public confidence that you are doing everything possible to do it in an intelligent, informed way, guided by experts and data and science, and not politically." I know that each governor is setting people in charge on two fronts, one on an economic front and one on a public health front, in regards to reopening each economy. And I think it's a brilliant idea to get the whole region involved in this effort, because the Northeast, probably unlike any other state or most other states, is truly connected with each other's economies. Think about the amount of commuting between New York, New Jersey, and Connecticut in New York City alone. Think about the amount of commuting from Pennsylvania into New Jersey, and New Jersey into Philly, and Delaware into these places. Obviously, there's a lot of community travel between these states, and we have to work together to see what's going on in each state. I think it's a brilliant idea on behalf of all the governors, and hopefully they figure this out right.
On top of all that, you're not just talking about, getting together, like, a few blocks on some farmland and saying, all right, you guys can go farm again. You're talking about a major metropolis that has to essentially restart its economy. So if New York is not on the same page as Philadelphia, and Delaware's close enough, you're pushing into DC. If they're not all on the same page, you could have New York moving 2 steps ahead of Philly, and it's just so much easier if you reboot this entire coastline's worth of economy, really, on the same terms. Everybody's playing on the same page, and it gives you a really great opportunity to ensure that everybody helps out. You know what I mean?
Absolutely. And to not sound, I don't know what word I want to use, to not sound, I'll say elitist. The New York, New Jersey, Northeast tri-state area economy is not just an economy for the Northeast. It is
It's a
a
global economy.
global economy. Like New York City has a GDP itself that's bigger than a lot of states and bigger than a lot of small countries. So the idea of reopening all of this together is huge, because it's like I said, it's a global thing. It's a global economy that these certain states in this region in the United States have to think about. And to open it in sections and slowly and plans, I think is the only way to do it, and it's the best way to do it.
And then the other thing that I really like, not to cut you off, Lewis, is that so they're nominating the economic advisor, a healthcare advisor, but also the chief of staff for every governor is going to be a part of this task force. So, there's really no excuse if one governor is lacking or one governor is, sort of off step with everybody, because this is going to be a task force that is really basically sitting in the office with every governor every single time they meet, news is met. So I'm hopeful that it'll be effective and it'll really achieve its mission because it's reaching into the highest parts of the cabinets.
And looking at this from a positive perspective, think about 2 weeks ago when we were talking about this. We were not talking about steps to reopen. We're seeing those plans be put into effect, which means that we could be seeing the end come sooner than a lot of people think.
You're right, Lewis. I think that, though, now that we are starting to see this downturn, what the next topic of conversation that you see when it comes to the healthcare professionals and the people that do the modelings is this idea of a second wave. And I don't know. I think that not that I don't know. This is something that we should definitely talk about, but it's something that we should have been talking about from day one. This isn't something that, oh, look we're doing well. Now let's talk about a second wave. We should have been talking about and preparing for a second wave while we were talking about and preparing for what was going on now. And we should have been talking about the steps that need to be, or not even the steps, the actions that need to have happened in order to reopen the economy. We should have been talking about all of these things the entire time. The economists should have been talking about how to reopen the economy, while the public health officials should have been like, okay, that's great, that's how you reopen the economy, but this is what needs to happen before you can feasibly reopen the economy. And along with that, hold on a second, because we might see a second wave of this in the fall. It's the nature of the beast. So that should have been a topic the whole time.
Since we're expecting a second wave eventually of this virus, we need to put in a plan, just like you were saying, of how many people do we need to see get this virus again, that we have to shut down everything again. We need to put numbers into place. We can't just have one governor saying one thing and one governor saying another thing. It really needs to be a whole country scale, if not a worldwide scale. Like if we're seeing, let's just say for argument's sake, we'll say 1,000 cases. Is that when we shut the schools down, or do we do it earlier, or do we do it later? We have to figure this out, because our economy, our countries will not last if we keep opening and closing for 3 months out of the year.
Absolutely, Lewis.
I agree. And the other thing that I had mentioned.
You good? All right.
Yeah.
So
the other thing, the other thing that I had mentioned was that I think there needs to be clearer sort of guidelines and information about who exactly is at risk. I think that there should be almost tiers of it. If you are, like, let's say somebody like me who has asthma, am I as high risk of getting this disease or being susceptible to this disease as somebody who might have, COPD? There should be some kind of guidelines. Obesity. Does obesity affect this? Some kind of easily accessible guidelines so people are able to determine what their risk level is, and then, follow the guidelines, but also have some independent knowledge on how this potentially affects them, and they can move about their days how they see fit. So if you're a no-risk individual and the governor says, you don't have to wear face masks, or they're optional, that you're probably safe going out not wearing a face mask. So it eases the burden on some people, and it also lets the people who need to be alert remain alert. With that, I'm just going to be right back.
Yeah, sure. And to jump off of Stephen's point, because it's a good point, you need to know, because you should be allowed to, I'm an individualistic person as a whole. The individual should be allowed to take in the risk and assess the risk themselves. Just like when you get into a car every day, well, not anymore, but when you used to get into your car every day, you were taking that risk upon yourself of possibly getting into an accident and getting injured that way. That being said, you could be not at risk at all, be an asymptomatic carrier and infect somebody that's at risk, that maybe your grandma or your mom or dad or grandpa, whatever it happened, or your little brother or sister even, right? So again, but that is knowing your family and the people you interact with on an everyday basis and putting, and the potential of putting them at risk too.
I agree with you on to a certain point. We have to see which individuals are more at risks and all of that. But I think that this time when they shut it down, I think it was the correct move to shut it down for the first time because we didn't know anything about it. But
Sure, Lewis, I agree.
Now that we're learning more about it, completely agree with you. We should see who's more at risk and open things up in phases, see people that are low risk be able to continue to work, things like that. Like I said before, we can't keep shutting it down for 3 months out of a year.
Absolutely. So moving on from that talking point, I think that this is a really interesting story, and it will probably eat up a good chunk of time here because I'm sure there's a little bit of disagreement, but this is about President Trump's remarks over cutting the World Health Organization funding. And so basically recently President Trump has been, this is a Wall Street Journal article obviously, I'll read straight from it. President Trump's decision to halt funding for the World Health Organization drew criticism from across the world as the number of confirmed coronavirus infections near 2 million, and the head of the European Commission predicted a very long exit from the health crisis. The death toll from COVID-19 respiratory disease caused by the virus topped at 127,600 on Wednesday, according to the data from Johns Hopkins University. The experts say this likely understates the extent of the pandemic. The U.S. accounted for about a third of the world's 1.9 million confirmed cases and had more than 26,000 recorded deaths. Meanwhile, South Korean voters in face masks and plastic gloves went to the polls on Wednesday in the world's first major national election during the pandemic. Governors in the U.S. outlined plans of slowly rolling back the sweeping virus containment measures that had crippled their state's economy, and Mr. Trump said he would soon speak to them about guidelines for doing so. In a parallel effort, the European Union officials set guidelines for ending national lockdowns and urged the bloc's 27 member governments to coordinate their moves. Mr. Trump said late Tuesday he planned to let individual governors run their own states and would step in if they needed assistance. The president, who has expressed an eagerness to move towards relaxing social distancing measures, had earlier suggested he had the ultimate authority to decide when states could reopen, a statement that experts said appeared to clash with the states' rights provisions of the Constitution. Going on, I'm trying to find here. A senior administration, Mr. Trump has sought to deflect criticism for his response to the pandemic, including lack of widespread testing, and presented problems getting critical medical equipment to states. On Tuesday, he cast the blame on the World Health Organization, a specialized agency of the United Nations, saying that it failed to act quickly to curb the contagion in China, where the virus was first identified. The president asserted that World Health Organization officials weren't skeptical enough of the Chinese official statements about the virus and said they resisted efforts by the U.S. to put a travel restriction on China. A senior administration official said that the funding halt would go into effect immediately. The official said the U.S. provided $453 million to the World Health Organization in fiscal 2019, and the administration would discuss sending the money that would have gone to the World Health Organization to other health programs. So, effective immediately, President Trump is withdrawing the rest of the aid the rest of the funding that would have gone to the World Health Organization. Before I'll open it up to you guys, I just want to say, while I do support looking at how we are funding international organizations as a whole, especially the World Health Organization, I don't think that doing it immediately is the correct course of action. I think that we should try and get over this, continue the funding the way it is, have our qualms and our problems with how they handled it, and then as soon as we get through this as a nation and as a world, then we can look at how the United States is funding this organization.
I get Trump's argument, and it's always been his argument, and that's what makes him that's one of the things that makes him a bad politician. He pretty much sticks with the same argument all the time, that he believes in America first, and I get it. He believes in America first. And I understand that we were paying more money to the World Health Organization than other countries.
Well,
And I also understand that Trump believes they did not do the best job they could have in the situation. But this is not the time to cut funding from the World Health Organization during a global pandemic. It's blowing my mind that he would even do that. From a few perspectives. One, the most important one, from a world perspective. They made a mistake in the beginning. Doesn't mean they're going to keep making mistakes towards the end. Number two,
you hope. You hope.
That's great, but if we don't have it, then it's like the quote, you miss 100% of the shots you never take. So let's take the shot with them and let's keep working with the World Health Organization. And number two, and this is what makes me not under... Siri goes off on my computer all the time. But here's what makes me not understand him as a person. You are running for re-election this year. And from a PR standpoint, just the headline, President of the United States cuts funding from the World Health Organization during a global pandemic. I don't care what they did. It's just not the time. That's my argument.
I agree, Lewis.
There will be a time to discuss what needs to be done better in the future. We're expecting more waves, but this is not the time. The time is later, or it was 2 months ago. The time is not now.
Lewis, I'm surprised because I'm not even blown away a little bit because I've been knowing that this man doesn't care about his image, that his base is going to support him no matter what. But on top of that, to the heart of the issue, his entire presidency has been defined by this sort of distrust, this ignorance, and this sort of, I'll call it a hatred almost, for international organizations that he believes don't evenly distribute, or they evenly distribute funds that are given by, other people. It's not a pay, you don't get what you put in, essentially. And I understand the problem with that, and that's his beef. But it doesn't surprise me that this trend is continuing to now. The optics are awful. And on top of it, I think not only is it a move that's consistent with the things he's believed and the things he's done, it's also a bit of a cop-out. I don't really buy the reason that he's doing it. We were not very quick. He's been getting up on that little podium every day, claiming that he was doing things that people said he shouldn't have done by closing the borders to China. There was 40 countries who had closed travel from China prior to the United States. So he wasn't the first to do it. On top of that,
I think he meant the first U.S. president to put those measures in place. I think that's what he meant.
Either way, I think it's misconstrued as saying they said I shouldn't do it.
Well,
and I took this great step.
They, as in the people of the rest of the United States government and the media in the United States. He was talking solely about the United States in that sense, because you remember what Joe Biden, now Democratic presidential candidate, said, that it was xenophobic and a bad decision to make.
All I'm saying is, I don't think it's a very fair point for him to be like, I did this thing that people said was bad because 40 other countries have made the same decision prior. You're following suit at that point. On top of that, the whole baloney about the White House or the World Health Organization and China, he tweeted literally within the week that he imposed the travel ban, saying that China was doing a great job to contain the virus and that the United States, his exact words, the United States greatly appreciates their efforts and transparency. It will work out well, in particular on behalf of the American people. I want to thank President Xi. And then less than a week later, you say, oh, I'm doing this great thing and I'm banning travel from China because they're lying about the numbers. Which is it? Which one is it? It's a cop-out. That's all it is.
So I will say this. I support the decision to cut funding from any international organization. I just think optically this is not the right time. Like you said, Lewis, I'm fine with the decision being made. Just today, right now, is not when the decision should have been made, right? And to your point, Stephen, which one is it? Is, their numbers, are they doing a great job or are they lying? And what the World Health Organization is, are they doing a great job or are they shadowing for the Chinese government, I would say a few things. All of the projections that we had for this virus when it was first going on in China was coming from China, and it consistently was wrong. All of our projections, all of our models were incorrect because of China and the World Health Organization. China was killing, imprisoning journalists that were trying to speak out against it. The World Health Organization was doing nothing about it. The World Health Organization continued to just let the Chinese, and Taiwan, which has its problems with China on whether or not it's an independent country, and South Korea. The reason that their responses have been so good is because they didn't trust anything that the Chinese government was saying. The country of Taiwan, when China said this can't be passed from human to human, like there's no evidence of human to human transmission, which was what China was saying in the beginning. The people of Taiwan and the country of the government of Taiwan didn't believe it from that point. And they said, in fact, we have evidence that it is human to human transmission. They gave that evidence to the World Health Organization, and the World Health Organization did nothing with that evidence. The World Health Organization has consistently, just in this pandemic as a whole, consistently just said whatever the Chinese government wanted them to say. And there are evidence of reporters asking questions of them and asking questions of their siding with the Chinese government and how Taiwan was acting properly, and they just ignored it and they hung up on the reporters because they didn't want to answer the question, because they are acting right now as a shadow of the Chinese government for who knows what reason. The United States puts about 15%, and I'll put up the numbers here from a New York Times article just so you could see, for funding wise. The United States contributes about $553 million to the World Health Organization's biannual budget, so that's every 2 years. And the whole budget was $6.3 billion. So the United States puts in about 15% of the budget every year, right? Most of the money in the United States goes to programs like polio education, developing vaccines, increasing access to essential health and nutrition services. Just 2.97% of the U.S. Contributes to emergency operations, which is still more than the percent that is earmarked to do it. Along with that, when you look at it, China does not put nearly as much money in as the United States, and a lot of the money also comes from private institutions and private funders and things like that from the World Health Organization. So the reason that they claim that China doesn't put as much money in is because they are a developing country, and so it's basically split up on what your GDP is, what the size of your country is, and so how much you can afford. China, I'm sorry, China's not a developing country anymore. It has the second largest GDP in the world, close to being the largest GDP in the world, and it has 1.3 billion people. And I was talking to our general manager, Annabella, about this earlier. The way she described it, it's like, imagine you put a second story on your house, and now you have to, when you put a second story on your house, you have to report that to the government because you have to get a certificate of whatever. You have to get a certain certificate for it, and your taxes will go up because you put an addition to your house. So it's like they put these additions on their house, but they never reported it, so their taxes never went up. The amount that they have to pay to the World Health Organization never went up, even though for this century, since 2000, there have been 3 epidemics, now pandemics, that came out of China alone. So I completely agree with Donald Trump's assessment of the World Health Organization and his actions, but today is not the time to do it.
I completely disagree with the assessment of the World Health Organization. I don't think it's their job to police how the Chinese government distributes information. It's not their job to make a judgment call on how they distribute information. I think that organization functions on receiving information, internalizing it, which is where I would argue is probably where the issue is. I think that there was bad judgment calls within the World Health Organization to run with numbers, not to question numbers. But I don't think it's this big, acting as a shadow for China and China's this, China that. Don't get me wrong, China is absolutely a maniacal country who is up to no good. But taking it as far as you just took it and as it's being categorized, I think is completely out of proportion. And I think that by pulling it to such an extreme, you lead to what our president did, and you make an extreme decision to cut funding from an international organization that helps billions of people around the world in the middle of an unprecedented level pandemic. I think that is the result of bad decisions made in the World Health Organization, bad judgments made about those bad decisions, and then an overall bad decision. I think it's just bad from the start. But to blame it on China and make this seem like it's some kind of international power move to stick it to the Chinese and their disinformation, I don't know if I'm comfortable saying that. I think you should look at the World Health Organization to begin with internally. Who's in there? Who's making these decisions? Who decided to run with the information? Who is getting the information? I think that's what you have to look at. And if you want to talk about funding there, that's fine. If you say, hey, investigate these people, come up with some report about how you guys handled this, or else you're getting a quarter of your funding, I think that's a way more effective and diplomatic way to deal with the situation.
On top of it, I think that the United States in every international organization, except for, the Paris Climate Accord isn't an association, it's an accord. So every single international association, the United States puts an outsized share of the funding. Every single one of them. They pay more than what they agreed to and more than all the other nations do. And I think that, look, the fact of the matter is, if the United States paid what they were supposed to pay, right? Paid what everybody else agreed to pay, and they paid that amount, the United States is still the bad guy. So
I don't think so.
I
think
I know so. Like I know
don't
it.
know how you know, but I think that we put in this amount of money because we want to maintain this superiority world superpower complex and be like, you didn't ask for 553 billion, but we're rich and we gave it to you. I think that's what it is. And I think that if somebody wants to come in and complain about that, change it then. But
you know how I know that it is? Because Donald Trump talks about cutting funding to the United Nations and cutting funding to the World Health Organization and cutting funding to NATO, saying that we should be paying our share, not everybody else's. And he gets raked over the coals.
As he should, because it's a completely, if you believe the things that I do, that globalization is good and international organizations serve a great benefit to society, then absolutely it's ridiculous that the guy who is the leader of the free world wants to stop contributing to these global efforts.
No, he doesn't want to stop contributing. He wants to contribute the amount that everybody else does. Because if it's supposed to be a global effort, why are we putting an outsized share as the United States?
That's great, but that's not what he did.
He
can say that all he wants, but he needs to do what he does. He has to do what he says for me to ever believe him.
And it's not what he has done. And on top of it, it's completely ridiculous. That is like lining up Jeff Bezos and the homeless people in San Diego and saying, all right, well, you guys are all part of the community, so you're all going to pay the same amount of taxes, and it is
a flat tax, which I agree with. No, it's this. It's 2% of your GDP.
That's exactly what it is.
No, it's 2% of your GDP.
How do you expect the
a flat
people,
tax,
the homeless people,
it's
to pay
like
for
this.
it? And Jeff Bezos has so much.
Steven, because how it's done.
AJ.
It's because how it's done is by percentage. It's a flat tax, meaning we agreed to pay 2% of our GDP. It will still be more money than every other country because we have the largest GDP. Just like in the analogy you put up, it's putting the entire town and saying everybody owes 9% of their income.
But that's not what I said. I said everybody, if we all contribute the same amount. If we all agree to contribute the same amount, because there's 280 something countries on the planet, it is not reasonable to even imagine that we would get appropriate funding if you say, all right, every country contribute 2% of your GDP, and you look at a country like Ghana and who knows what 2% of their GDP is, whereas in America, it's billions and billions of dollars.
Exactly. Exactly. But the point is, we agreed to pay 2% of our GDP. That's what everybody agreed on. The 293 countries, or however many countries there are in the world, agreed. Everybody in this organization, I think it's 174 countries in the United Nations, and however, there's 40-something countries in NATO. They all agreed to pay X amount of their budget. And the budgetary constraints that come along with that were agreed on by every country that signed in. The United States paying more than that is not following the agreement. So if we were to say, okay, we're just going to pay what we agreed to pay from the beginning, which we should have every right to do because that's what we agreed to do. When we have our own problems here, remember we're in $23 trillion of debt that we also have hanging over our head. So,
but do you understand the optics?
I quite frankly don't care. I don't care about the global optics.
Okay, well, we don't live in an isolated society. We're all connected. We have an international supply chain, international trade. So
sure.
You should care about optics because these are the people that you're dealing with, that you're doing business with.
Right, but I think
so how does it look if America, back in 1946 or whatever, says we're going to contribute 2% of our GDP, and then over time, because we can afford to, we contribute more. We take the leadership mantle and we carry it further. We do more than what is expected, like a good leader or a good person or a good country would.
But we can't afford it anymore, Steve.
Says who?
Says the $23 trillion of debt that we're in.
You think that's going to get paid? You're funny.
I don't think it's going to get paid, but I don't think we should keep racking it up.
My point is, there's better ways to cut debt. Why do we need $1 trillion military?
We don't. And I'm saying we should be cutting across the board, including in these places.
That's fantastic for you to say. But when the president gets up there and him and Nancy Pelosi sign these tremendous budgets,
I have an issue with it.
And all he cares about is, well, America's not getting the stuff from the World Health Organization, so we're going to stop funding that. It's a little ridiculous, and it shows that he has no real thought or intent that goes into any of the actions that he does.
Sure.
But the optics, just back to the optics. How does it look when the country that took the step, you did the extra thing, in a global pandemic, even not in a global pandemic, decides to say, you know what? We don't want to do this anymore. Who picks up our spot? Because then you're throwing your superiority complex in the air. Who does it then? Does China come in and say, oh, yeah, we'll pick it up?
Steven.
And then everybody's buddy-buddy with China. But we have a problem with that. Like, we have a problem with it right now, supposedly.
How many times did I say that we shouldn't be doing this right now? This is a bad time to do it.
I completely agree. In the future?
No, in the future, I think we should do it. In the future,
so Russia can come in and supplement our funding?
Here's the thing. In the future, we shouldn't cut funding, right? It shouldn't go down to zero. We should be paying the same amount as everybody else that we agreed to pay. The 2% of our GDP, which guess what? It's still more than everybody else. So I do think that we should continue to pay our share in these organizations. We shouldn't completely pull out. We shouldn't bring it down to zero. But we shouldn't be paying 15% of the budget when we only agreed to pay X amount of the budget that isn't 15%.
You were talking about percent of GDPs. 2% of our GDP could well be 15% of the budget.
It's 2% of our GDP for, well, when you look at it, okay, we all agreed to pay 2% of our GDP in something like NATO. We pay far more than 2% of our GDP and far more than our share in NATO. Right? So if we bring it down, that is us doing our fair share.
I don't think it's fair to give people something for such a long time and then suddenly have a problem with it and take it back. I don't think that's fair.
It's like saying this.
Well, hold on. Actually, I'm going to butt in here for a second because you guys are talking in circles. You guys are both saying the same thing. So I'm going to put a little perspective in here. You said, Stephen, that you don't think it's fair to give somebody something for so long and then take it away.
Correct. If NATO is used to receiving checks that say, just for discussion's purposes, $100 billion and the organization operates and it functions well on $100 billion on an objective measure, not on anybody's biased standards, functions well on $100 billion, and you show up next year and you say, yeah, so turns out we're only going to give you 50. That's not very fair. I think you're putting the organization and the people who benefit from it in jeopardy.
So, Stephen, let's use an analogy because you used one before and I thought it was effective. We'll use one here. You and I are friends, right? I would say good friends.
I'd say so.
All right, we're best. We're some of the best of friends. I am giving you my car. Congratulations, Stephen. You can have my car. Sounds good? All right.
Sure.
Congratulations. You're now the owner of a Toyota 2007 Corolla. Congratulations. So I'm going to give you this car, and you keep asking for it, so I'm going to keep giving it to you, keep loaning it to you. And then a year from now, your friendship with me, the stuff that you've been giving me that I felt was good to give you my car for, has gone away, and you haven't been helping me out in the same way. I'm going to stop giving you my car. And so I think it's okay that Trump is looking to take away things from these organizations. But again, I think we're all in agreement here that this is a bad time.
Let me put this into perspective for you then, because I think you mischaracterized a little bit. Let's say that you give me the car, right? But every week I fill up the car to the brim with donations for the local food shelter, for the homeless shelter. And that's what I use the car for. You don't feel bad about taking the car away?
He shouldn't. It's his car.
It is my car.
It's his car that people rely on, other than me, for things that they can't have, for essential services.
But the problem
for things
is
that change and elevate their life.
Yeah, no, I don't think he should feel bad at all. It's his car.
That is completely
disgusting
ethical.
Hold on.
Judgment.
If I'm to make a donation to an organization, that doesn't mean I have to keep making that donation if that's not what I agreed to. The same way that a boss doesn't have to give you a monthly bonus if they never agreed with that in the first place. All of these things, now's not the time to take away that benefit. Like now, if our friendship was straining, I wouldn't take away the car now if you're giving food to the homeless people. But in a few months, when your life's getting better and you can afford to get a car, when the world is feeling better and we can get out of this pandemic, that's the time to start talking. Hey, I need a little bit more from you, and we need to have that give and take.
And on top of that, it's like this. It's like your parents give you an allowance of $100 a week, but then your dad loses his job and he can't give you $100 a week. You might be relying on that $100 a week, but dad can't afford it anymore. You got to get rid of it. You don't get $100 a week anymore. Sorry. You get
what the problem is?
$20 a week.
You guys are talking on such small scales. And what we're dealing with is a complex web of economies and individuals and
It's an analogy, Steve.
I'm just saying it's an inaccurate analogy. It doesn't accurately represent the situation.
Okay, so then by that, neither are yours.
I completely imposed my perspective on it into the analogy.
Right, and I'm even if my dad's giving me $100 a week and I'm bringing that $100 a week to pay for 5 of my classmates' lunches every day.
Sure, but America didn't lose their job. America has the money, and that's the problem.
America doesn't have the money. We are printing the money, which is a problem in and of itself. We're just continuing to print the money. I disagree with everything that's going on here, from the fact that we're not addressing $23 trillion of debt to the fact that we can cut the spending and we're not.
I think you are looking at this in a completely incorrect lens, that it's somebody else's fault. I think it's the fault of America for getting ourselves in this situation. And
absolutely.
That's it.
That's why we should cut the spending, though. Because we got ourselves here, so we should be able to take ourselves out.
But here's the thing. I'm not a fan of walking backwards. I don't like the idea of stopping the progression, because that's what I see it. I see it as progression. I see if the World Health Organization in 1998 says, hey, USA, can you chip in? We need a little more. And we gave it to them. We took a step forward in the right direction to continue funding this organization that's doing good things for other people.
And they're not doing good things now. So, like, they failed.
But to who?
They failed. They failed.
How did they fail? In your perspective.
Okay. How did they fail? I'll explain. No, I'll explain. Because the reason that Italy is so bad, the reason Spain's so bad, the reason we're so bad is because of a bad information that they didn't check, they didn't confirm, they just took for the word, right? Even though
your
they were
problem is-
presented information that was to the contrary.
Your problem is that you're blaming an organization for actions taken by individuals. It's a really easy way to cop out of international relations.
The organization that had done this before, too, because they did it with other diseases that came out of China that resulted in epidemics and death.
Yeah, the individuals, not the organization. To claim that the organization, that the paper document is failed, is a complete misrepresentation of the issue.
But okay, the individuals that are in the organization have failed repeatedly, and the individuals have changed since the other epidemics that came out of China, and they're still failing.
Do we know that?
Team.
Do we know 100%?
Yes.
All right,
You
team.
have the
So-
roster up right now.
I can pull it up for you and send it to you after because we only have a minute left.
So to wrap this up, I always like to end on a happy note. And I know it's not my show, but if you'll let me, I would like to wrap something
I
up.
also like ending on a happy note, Lewis.
We all agree that this should at least not have been done now.
Correct.
It shouldn't
We
be
agree with
period.
that?
I agree
Either
that
way.
it shouldn't be done now. Yes.
We all, right now, no matter what happens, this is the time that we have to all be together. We all have to work together. And if we don't all work together, and if we all are bickering and arguing about this, we are not going to move forward. Either way, we all need to work together, because if you pull your weight and you don't, we're back at a net zero. So we all need to be together. And I think if we're going in a worldview on a totally different topic, I think right now in the world, that is what's happening on the whole. I think that most of us are working together, especially here in New Jersey and the United States people. I think that the people are doing a good job of working together.
I would agree. And just so you know, Stephen, the head of the WHO was put in the position in 2017, just
Okay.
for reference.
Get
And
rid of them.
with that, this is the top of the
Just
hour.
Get rid of them.
This is the top of the hour here at 90.3 WMSC, Upper Montclair, New Jersey. I agree we should get rid of the head of the WHO while sweeping the whole thing with it.
That's not it.
That's my opinion, and I'm AJ Melillo.
I'm Stephen Rumbolo, and I love international organizations and globalization, because that's the way of the future.
And I'm Louis Biondolillo, and I would just like to get out of this mess and ride a roller coaster.
Everybody, this is the Sons of Liberty, and remember, listening is easy, but doing is harder. Have a great week. Stay healthy, and hopefully next week we can get into some more news. See you soon.